Hi everyone, I hope you're all having a great summer. July is behind us and I guess a lot of you will still go on some PTO, some well-deserved rest, but for some of you I guess the year is in full swing again. It's definitely the case for me. Today I was planning to talk about the power of technology in clinical trials. As you all know, I am an optimist when it comes to technology. And I do deeply believe that with technology and better use of data, we can make clinical trials better. And better means more patient-friendly. Better means more effective, as in we get better data out of these trials and we get treatments to patients faster. You may also know about me that I am trying to drive an agenda for ensuring that we really leverage every single data point that comes out of these trials to help make better decisions about patients. So really also driving forward the evidence-based medicine agenda. And so I can talk about my favorite themes of decentralized trials or patient-centric trials, as I like to call them. Human-centric might actually be an even better term that I try to use very often. I speak a lot about eConsent and its challenges, and that's where I wanted to pause today for a second, because it's very easy for me or my colleagues to go on stage and to wax about how we can use technology to make trials faster and shorter and ultimately more friendly for the participants in the trial. But I think that would risk being a little bit tone deaf to what we're hearing in the market from all important stakeholders. There is a lot of dissatisfaction with technology. And if there is dissatisfaction with technology, there won't be adoption. And that means we're stuck in the present. Basically, we're stuck with things being as they are. So I want to call out to everyone, our colleagues in the market, fellow vendors, our customers, sponsors, CROs, but maybe most importantly also site staff, the CRAs in the field, everyone who's involved in clinical trials, the trial participants obviously. Find a channel to make yourself heard and to reflect on what's going well, what's not going well. I think there are constructive ways to deliver feedback on how technology is helping you and how it's not helping you. Because if we have access to this information, and obviously we do, it's right there. But I think if we all make a concerted effort to continue to give each other feedback in constructive ways and speak very clearly about what works and what doesn't work, we can really also achieve this promise of technology in clinical trials, of making trials more patient-friendly through higher patient or better patient education, and with that better retention in trials, of shortening clinical trial timelines by being way more efficient. And of course, there's a ton of things we can do with artificial intelligence. But again, if the community, all the individual stakeholders in the system don't adopt this technology, then we're not going to go anywhere. And that begins with listening to each other, but also speaking up. And so Castor is committed to making that happen. And specifically, when we're talking about eConsent, we're spending a lot of time with the people that are using this technology, often the sites, and listening to what makes it difficult for them. Does single sign-on make it better so you don't have to log in separately? How do we ensure that we don't create extra work for you when interacting with the patient? How do we make sure that you know exactly why you'll get better results if you use eConsent, if your patient is better educated, etc.? And I think we can do more, but you can contribute to that as well. So I want to just ask all of you to continue to bring the conversation and really make sure in a constructive way everybody knows what would it take for all this potential to truly come to fruition. So I look forward to hearing from you on the various channels we're on, and obviously to get your feedback on the technology that we put into the market, and we'll continue to drive this agenda forward. And I want to call out, we have a couple of webinars coming up on some of our products, including eConsent. So keep an eye on our LinkedIn feed and make sure you attend these webinars so you get to see how we think about these problems and how we think we can address some of these challenges. And obviously this is a great opportunity for you to give feedback. I'm also very excited to do more LinkedIn live events with people. So if you're open to doing an event with me to speak about some of these challenges, by all means, let's get it scheduled and let's get out there and make ourselves heard. Okay, that's it for now. See you all soon.